Welcome back. We will continue the lecture series about abuse and neglect by talking about the signs we may see during our time with the patient. Physical abuse often leaves visible clues, but they may not always be obvious without a careful exam. As an EMS provider, when you suspect possible abuse, you want to perform a thorough head to toe assessment, while still treating any immediate issues, of course. Sometimes crucial evidence of abuse is hiding under clothing. In fact, one of the biggest mistakes is not fully exposing a patient when you have suspicions. For example, EMS providers have missed key injuries on babies because they didn't remove a diaper or clothing, a critical step if you suspect non accidental trauma. So let's talk signs. Unexplained or poorly explained injuries. If you encounter injuries like bruises, welts, burns, or fractures and the explanation is absent or doesn't make sense, be alert. Maybe the patient or caregiver says, "I don't know how that happened," or gives a story that just doesn't add up. Like a toddler with a broken femur supposedly rolled off the couch. A low height fall rarely causes a femur fracture. In domestic violence, an adult with a black eye might claim, "I walked into a door." As EMS providers, we often hear odd explanations for injuries. Most are probably true accidents, but inconsistent stories or a delay in seeking treatment should raise suspicion. Also, if the story keeps changing between the patient and caregiver, that's a red flag. Think about bruising patterns and locations. Certain bruises scream, "This wasn't an accident." Pattern injuries are a big one. For instance, you see a bruise that has the clear outline of a hand or fingers from a slap or grab, or round burn marks the size of a cigarette tip. You might see parallel lines suggesting a cord or belt strike. These patterns are very unlikely to be from normal accidents. Also, consider the location of bruises. Children, for example, often bruise on their shins, knees, elbows, or forehead from play. These are expected. But bruises on soft parts of the body like the abdomen, back, buttocks, or inner thighs are concerning. One useful guideline in pediatrics is the 10, spelt out, 4 rule. Any bruising of the torso, ears, or neck in a child under 4 years old, or any bruise in an infant under 4 months, is highly predictive of abuse. A baby who isn't even crawling shouldn't have bruises at all. So if you see one, that's a big red flag. For elders and dependent adults, bruises on the inner arms or around wrists, ankles, might indicate being grabbed or tied. Bruises on the face, especially black eyes or bruising behind the ears, could indicate blows to the head. Injuries at different stages of healing. If you notice, say, an older, scabbed over laceration along with fresh cuts, or x rays show a mix of older fractures and a new fracture, it strongly suggests repeated injuries over time, classic for ongoing abuse. In a child, multiple fractures of varying ages, especially rib fractures, which are unusual in accidents, should make you think of abuse, like shaking or squeezing in infants. In an elder, a mix of old and new bruises could mean frequent mistreatment. Defensive injuries or restraint. Marks. Victims trying to protect themselves might have injuries on the backs of their arms from blocking hits, or on the palms. Someone who's been strangled might have bruises on their neck or petechiae, tiny red spots from burst capillaries in their eyes or face. Look for ligature marks on wrists, ankles, or even the corners of the mouth from a gag. These indicate the person may have been tied up or restrained. On elders or dependent adults, check for any signs of restraint like redness or abrasions on wrists, ankles, or pressure ulcers in odd locations, like only on one side, which might mean they were kept in one position too long. Also, pay attention to the demeanor. Is the patient fearful or flinching when you touch them in examining the injury? Do they seem scared of a particular person in the room? A physically abused person might be jumpy or cringe as if expecting to be hit. Children might cower or not want to be near a certain adult. One more note, abusers might avoid seeking care for the victim to hide injuries, so by the time you see the patient, the injuries might actually be in worse shape: infected wounds, improperly healed bones. Or conversely, they might frequently use different hospitals' EMS to avoid suspicion from any one provider noticing a pattern. Keep an eye out for repeat calls to the same address, too. In summary, bruises, burns, breaks. The 3 Bs, especially when unexplained or in odd patterns, are your big indicators of physical abuse. Always assess if the story matches the injury, and when in doubt, trust your gut and look closer. We'll discuss what to do if you suspect physical abuse when we get to reporting, but first let's cover the other abuse types, starting with sexual abuse. Sexual abuse can be one of the most challenging forms to detect because the physical signs aren't always obvious and victims often feel intense shame or fear about disclosing it. However, there are some red flags to be aware of. Physical signs in the genital area. Any unexplained injury to the genital or anal region should be taken seriously. This could be bruising on inner thighs, blood or lacerations in the genital area, rectal bleeding, or pain in those areas. For example, a child might have difficulty walking or sitting comfortably, a classic warning sign for possible sexual abuse. Their underwear might be bloody or torn. In an elder or dependent adult, you might notice bruises on the breasts or groin, or find their adult brief soiled with blood. If you're called to evaluate vaginal bleeding in an elderly woman who is not on any blood thinners or something, sexual trauma could be a cause to consider. Sexually transmitted infections in children or in elders who obviously wouldn't be sexually active otherwise are a glaring sign. If a 5-year-old has gonorrhea, there's no innocent explanation for that. Similarly, pregnancy in a young girl, especially under age 14, is a red flag. That pregnancy itself could be evidence of rape or molestation. As EMS, you might not diagnose an STI or pregnancy on the spot, but you might hear it from medical history or the receiving hospital. If you transport a 10-year-old who is pregnant, that clearly indicates sexual abuse. The behavioral signs and symptoms. Victims of sexual abuse often have strong emotional reactions. Children might suddenly become very withdrawn or conversely very aggressive. They might exhibit sexualized behavior or knowledge that is inappropriate for their age. For instance, a young child might act out sexually with toys or other children in a way that seems far beyond normal curiosity. They could also have sleep disturbances like nightmares or start bedwetting even if they were potty trained. These can be signs of trauma in general. Some kids might run away from home or school to escape abuse. A previously outgoing child may become anxious about being left alone with a certain caregiver or at a certain place, like they suddenly dread going to a particular daycare or relative's house. They might also have a change in appetite or other psychosomatic complaints, stomach aches with no medical cause. Adults and teens who are sexually abused, like in domestic violence or in care facilities, may likewise show depression, extreme anxiety, or start abusing substances to cope. They might avoid specific people or places tied to the trauma. An adult victim might not allow you to examine them fully due to pain or fear in those areas. Sometimes victims will try to tell someone, but maybe not in straightforward ways. A child might hint by saying weird things like, I don't like Uncle Jack, or draw pictures with sexual themes. They might blurt something out to a teacher or friend. If, as an EMS provider, you hear a child say something like, Daddy hurt me, or don't let mommy leave me with that man, you need to take that seriously. Even if you're not sure what it means, it's worth reporting for investigation. Older victims may be more tight lipped, but occasionally someone might confide in a medic if they feel safe. For example, a sexual assault victim in a domestic violence situation might quietly say something once the abuser is out of earshot, or an elder might whisper to you, he does bad things to me, referring to a caregiver. Always give an opportunity for the patient to speak privately if possible. It's important to realize that lack of physical evidence does not mean no sexual abuse occurred. Many forms of sexual abuse, like fondling, may leave no visible marks. Also, injuries can heal, and victims often delay disclosure, for years in some cases. So use the whole picture: physical findings and behavioral cues, and any gut feeling you have from the scenario. For instance, an EMS provider might be called for a 3-year-old with abdominal pain and vomiting. If you notice the child clings to you but is terrified of her stepfather and she has bruising on inner thighs, you might suspect something like sexual abuse causing internal injury or just the stress manifesting physically. You would treat what you find, ensure the child is safe, and definitely report those suspicions. In any case of suspected sexual abuse, whether it's a child, a disabled adult, or a domestic violence victim, your job includes getting them appropriate medical care. They may need a forensic exam at a hospital by a sexual assault nurse, and reporting it to the proper authorities once immediate medical needs are addressed. We'll cover reporting soon. Emotional abuse, also called psychological abuse, can be harder to spot because it doesn't leave visible bruises, but it's incredibly damaging. This involves behaviors like constant criticism, threats, rejection, isolation, or humiliation by the abuser. It often accompanies other types of abuse, but it can occur on its own as well. Here's what to look for. Victims of emotional abuse might exhibit very extreme or inappropriate behaviors. A child might be unusually quiet, shy, or fearful, excessively well behaved, or overly compliant, as if walking on eggshells. They may hardly speak or look at you, or they might be overly eager to please. On the flip side, some children might display extreme aggression or oppositional behavior, lashing out at others because that's the behavior modeled for them, or as an outlet for their inner turmoil. You might see a mix, for example, a child who is very withdrawn in general but has sudden angry outbursts. Children suffering emotional abuse might also behave in ways that aren't age appropriate. Some become parentified, taking care of siblings, acting very adult, or conversely regress to infant like behavior, rocking, thumb sucking, or wetting themselves. Adults facing emotional abuse, like in intimate partner violence, could also swing between extremes, appearing depressed and meek at times, and then perhaps having sudden anxiety attacks or angry reactions in other moments. A hallmark of emotional abuse is the destruction of the person's self worth. The victim might verbalize feelings of worthlessness, like saying, I'm stupid or it's all my fault, a lot. They may have a flat affect, showing little emotion, or seem deeply sad or hopeless. You might notice an adult victim constantly apologizing for things that aren't their fault, as if expecting blame. A child might say negative things about themselves that sound oddly mature, almost like they're repeating insults, I'm just a bad kid, or no one could ever love me. These can be echoes of what the abuser tells them. In severe cases, victims, including teens and even children, might show signs of self harm or suicidal thoughts. Any suicide attempt or self injury in a child or teen should prompt you to consider if abuse of any type is happening, even if they don't say it outright. Just as with physical abuse, if someone is being emotionally terrorized, they'll likely show fear around the abuser. You might observe that a patient's demeanor changes when a certain person enters the room. They might flinch at sudden movements or loud voices. An abused elder might seem anxious and try to appease a domineering caregiver, or they might be unusually hesitant to answer questions and glance at the caregiver as if seeking permission. These are all nonverbal cues. Emotional abuse, especially in childhood, can literally affect brain development and lead to long term cognitive and emotional issues. You might notice a child is far behind in language or social skills for their age, which could be due to neglect or emotional deprivation. They might have attention or learning problems or physical symptoms like frequent headaches or stomach aches with no medical cause, stress induced. In any age, chronic emotional abuse can contribute to anxiety disorders, PTSD, depression, and even physical health issues. The mind body connection is strong. You might not diagnose these on the spot, but you'll see hints, like a known history of depression or substance abuse in a domestic violence victim. In older victims, like a controlled spouse or elder, sometimes you'll see a kind of learned helplessness. They seem resigned, won't make eye contact, and let the abuser talk for them, as if they've been conditioned to not make waves. Sometimes emotional abuse is the only abuse present, but often it's part of a larger pattern including physical or sexual abuse. Regardless, it's traumatic. In fact, victims often say the emotional abuse, the fear, humiliation, isolation, was as bad as or worse than the physical injuries. As EMS, you might be the first to pick up on these subtle signs, since you're observing people in their home environment often. If you suspect emotional abuse, say you don't see any bruises, but you witness a caregiver screaming at an autistic adult in a really cruel way, or a husband constantly belittling his wife who attempted suicide, it is just as important to report and document your concerns. Emotional abuse can be harder to prove, but patterns of it often come to light when multiple professionals note the behavior. We'll keep these behavioral signs in mind when we go through scenarios. In the next lecture, we will discuss neglect, which is another form of abuse often encountered by EMS, especially with children, elders, and dependent adults. See you then.